So good morning, everyone. Thank you for joining this first session of the IHE experience sessions of today, of June 17. For the next couple of hours, we are going to try to approach and discuss based on experience on the role of projectathons in national and regional digital health strategies. So this is a small, let's say, workshop. The idea is to, I will make a short introduction of how IHE services has been supporting and the different tools that we're using in projectathons. And then I will let the other participants present their experience and their visions about organizing projectathons and focusing on the importance of such testing events. So let me start with my short presentation. So based on what IHE does in the methodology, the testing part is one of the most important and crucial parts of the whole approach because it's the way of putting the specifications, the interoperability specifications under test, and it's a way of making them better. So the more you test, the better the specifications are. So in the process, we start from the standards, the different standards that we need. We organize them into use cases so that the specifications are created. And then those are tested at the Connectathons if they are pure IHE profiles, or then they can be tested in projectathons, which is the part that we want to discuss today. And usually in projectathons, we have a mixture of national and IHE specifications. And then we can also do and test again before going to production. And that's another type of testing that usually is necessary. For IHE, there are several types of testing that we are performing. We can divide this type of testing into two main groups. One part of testing is related to testing vendor products. So the mostly known part of testing is the IHE Connectathons, like the one which is now running in parallel of this session. And this year, due to the COVID pandemic, it's an online event. We hope that next year it would be again a face-to-face one. But we can use the same tools to support vendors in their own laboratories for testing in order to prepare their products for Connectathons or for other reasons. And IHE has also launched a conformity assessment scheme for 16 very mature IHE profiles that are used around the globe. Now that's a part of the product, but there is also the part of the project, which means that usually national or regional strategies, or sometimes project strategies, they are orchestrating specification in their own way. And then what we want to test is the project specifications. So that's what we're talking about, projectathons. And that can be also virtual projectathons. This is usually done when we are talking about pre-production testing. This is, for example, what the European Commission does with the eHealth DSI testing, setting several conformance gates and several testing periods using the same approach. Now, trying to differentiate the projectathons, it's good to remember what a Connectathon is, because the approach is quite similar. So during the Connectathon, a Connectathon is a peer-to-peer testing event, which means that system understood tests between vendors that are testing themselves for specific actors and transactions that are described in the IHE profiles. There are obviously some tests, some validation tests against Gazelle, which are done for validation of documents or messages, for example. But in general practice, the idea is to test, like in real life, how systems should interact between themselves. And all this is going through the testing environment so that we can deliver the different payloads and messages to the monitors to validate and check that they are correct against the specifications. Now, a Projectathon is again a peer-to-peer testing event that is organized in a similar way like a Connectathon. So it can be online or face-to-face. Usually face-to-face has some more advantages related to the human factor and to the creation of the ecosystem of people. It's much easier to let people communicate, obviously. So the difference that's between the Connectathon and the Projectathon is that at the Projectathon, we are testing an aggregation of specifications that make sense for a national, regional, or other purposes. So that means that a lot of things that we are testing in a Projectathon, we don't test on a Connectathon, and those are, for example, group testing or end-to-end testing that we match specific workflows. And we will have some examples of that. And I guess the different participants in the session afterwards will explain this as well. So usually those specifications, they are localization of the IHE integration profiles. And we take some additional information into account and constraints related to those local or regional or national parameters. The Projectathons, they are also multi-actors and multi-transaction sequence. And the idea is that they need to map real-life use cases and information exchange. So that's not an idealistic approach of testing for integration profiles like we do in Connectathons, but a real-life testing. And the important thing is that we are using in Projectathons, as IHE at least, the same tools as we use in the Connectathons, which means that those are really well known by the vendors, and that simplifies quite a lot the testing paradigm. Just to summarize this in a short table, between the differences between the two types of testing. So concerning governance, the governance is under the supervision of the IHE regional or national deployment, while in the Projectathon, the supervision and the ownership is done by the owner of the project. So the lead organization that organizes and has usually also the leading role in managing the strategy, the healthcare digital health strategy. Concerning the rule of passing the tests, so those from the Connectathon, those are based on the test plans that are created based on the IHE integration profiles. So those, all the criteria are implemented by the IHE technical teams. In the case of the Projectathons, those are fit for the project specifications. So the criteria are developed by the project, and we can have additional criteria related to national rules or to workflows or group testing that are necessary. And concerning the publication of the results, at the Connectathon, those are made public through the IHE channels, so the Connectathon results and the integration statements that the different vendors can publish and that are also published in the registry maintained by IHE International. While in the Projectathon, this is maintained and published by the project and the lead organization that is organizing the Projectathon. So this is a quite recent drawing that has been created, trying to aggregate everything related to the testing part and the testing continuum. So here you can see the different types of testing that we have. So we have, I said, testing that is managed by IHE, like the Connectathons, like the conformity assessment, which is not a peer-to-peer testing, but it's testing, I guess, a specific testing machine that is conformed with a specific set of IHE profiles. And we have a new type of testing in the medical imaging domain that we have been developing this year, which is the IHE Shara zone. And there was a previous session on that. I hope that some of you had the chance to learn more about that. And as well, there are the project managed testing that can be done with or without the support of IHE services. And then, as said, we have several ways of controlling and publishing the results. So the Connectathon publishing the Connectathon results. Then the Projectathons can use the test reports from the Projectathon for their own project labeling in some cases. And while the conformity assessment creates product labeling, so the test report there is used or could be used by national programs for certification. So there are other types of events that we can participate that are related to testing, but in a more loose approach, like the HL7 Fire Connectathons, the IHE Plugathons, which are like small proof of concept of testing for specific use cases. And some cases even more, let's say, in the innovation part. Sometimes we can support and participate in hackathons and other type of events. The scope of all this is to try to enhance the quality in the procurement process or the deployment phases, reducing risk and costs for both the national programs that are launching all this and the vendors that are usually participating in the deployment. And finally, the last important part is that all this is done so that we have happy end users with systems that fit their that are fit for purpose in the real life implementation. Just a few words about conformity assessment, just that we have a complete view of the approach related to the testing continuum. So again, we can compare the conformity assessment testing related to the Connectathon, which is the usual approach. So conformity assessment is targeted to specific products that are commercially available, while in a Connectathon that can be a prototype. And the test report that is being delivered is more thorough, based on very specific mature IHE profile specification that can be imported into Gazelle, which is the testing platform. So the rigor is much more increased, and we are talking about final products that every 2 or 3 years they have to check again with the conformity assessment rules if they've still been covered. Trying to map this in another nice drawing, we can see that we can have the same testing tools for different purposes, and we can increase at each level the thoroughness of the testing. Now, how we do all this, the basic component behind this is the ecosystem in testing, and all this is connected through the testing platform, which is Gazelle, and I guess most of you already know. So Gazelle is really the center of everything. It's used for early adoption of new things. So Gazelle has an innovation plan, and every year we add new tools, test plans, test scripts, simulators, validators, depending on the case. All the tool developers are using it to create new tools. So we don't put only tools that is developed by the IHE services team, but in many cases we integrate existing testing tools that are built from other communities. the main purpose of all this is that all those tools are usually open source. So this is how we can see this. The scope is to aggregate all the different standard specifications. Usually those, they are entered and handed and organized in a technical way through different authoring tools. And for several of those cases, we have created even automated scripts to be able to insert the specification into the testing tools so that we reduce the human error as much as possible. And then we have the testing tools, which, as I said, they can be of various flavors. And we integrate also third-party test tools like the NIST tools that we use for the XDS group of profiles, or the CTT tools that we have now included since this year for the PCT domain, which includes also all the needed testing with Continuum Health Alliance for the medical device testing. And we are working a lot at the global scale on integrating FHIR tools to be able to support a lot of new national and regional projects that are basing their strategy based on FHIR specifications. So that's quite a famous drawing. I guess you have seen it in the past. That again puts Gazelle in the center, where we can put all the profiles, all the interoperability specification. That means that in Gazelle we can also include testing for non-IHE related specification. Several projects, national or regional, are doing this. They have, in some cases, some purely custom specifications based on previous, let's say, implementation that have been deployed in the past, or other standard-based implementations that are not encrypted, let's say, into IHE integration profiles. So that's even possible to test non-healthcare testing if you wish, since Gazelle is a GATB compliant test platform, and it has been used in the past in the electricity domain, for example, for smart metering. Just to mention a little bit the Gazelle innovation, and that's something that it's good for all of you to know, that all the projects, they are contributing to the sustainability and extensibility of the testing tools. And whatever is being created by the various projects usually is implemented into the enterprise edition of Gazelle, which means that it's in the benefit of the whole community, not only for the Connectathons or the different projects. And this is the way that we can increase the footprint of Gazelle that can be reused in many places. This is just a short description of the works that we are working this year into Gazelle. So that's multiple FT implementation program that is running in parallel of all the other efforts and projects that we support during the year. So Gazelle, as you know, is an open source software. So there is you can download all the components and install them by yourself. But usually what is the preferred way is to use the enterprise edition that is validated and supported by IHE services. And you can either use it in an in-house implementation, so on premises, or you can use the one that IHE services offers in the cloud. And there are specific support and maintenance packages related to that. There are about 25 instances of Gazelle that have been implemented in the recent years. Most of them are operational, and most of them are currently supported by the IHE services team. Now, since testing is about specifications, we have put quite a lot of effort in the last years, and with the several projects that we have, to try to integrate specifications and test tools so that we have a set of tools that we can have and provide an end-to-end support to the different national or regional programs that request our support. So in that sense, from the production of the specifications, we are using several tools that we can create the specifications. Then as IHE International is doing for the different domains, we also try to go the same way and start implementing those specifications with wikis and using GitHub. So we propose national and regional projects to create their own GitHub website. And then this is usually aligned with other national Ministry of Health or other places, public consultation places where you can put the specifications for public consultation. And then those are driven and used in the Gazelle test tools for testing. So trying to close and give the floor to a more interesting presentation than mine. Why do we do Projectathons? That's, I think, an initial idea, but let's see what the different participants will say. I think, and what we have seen by our support during the last years, almost 10 years of Projectathons that we have been doing, is that this is really enabling the co-creation of the specification, the cycle of creating specification, testing, making them better. So it's really a revised approach of the IHE international methodology about creating specification integration profiles. And this can be done at several levels, so country levels, regional level, or even project. And we have been supporting several types of all of those. The idea is to test and refine the quality of the interoperability specifications and prepare them for a good, either in the domain of procurement, or prepare those specifications for the deployment and the production phase. And what many projects are doing is usually they are creating a reference implementation that is usually opened to the vendor community to be able to test at any moment. And in some cases, the snapshot of these reference implementation are created, reused for certification purposes. And I think the main part of all this is that we create a digital health ecosystem. And I guess Athanassios from Greece will try to explain how this also has worked in the Greek case later. So just a snapshot for the future. As you know, IHE Services has been spin-offed from IHE-Europe with the collaboration of other IHE deployment committees, mostly IHE USA, into a more stable and global entity, which is called IHE Catalyst. This has happened very recently, early this month. And you can, would invite you to follow the presentation of IHE Catalyst later today. It's at 2 p.m. Central European Time. You can get the registration link from the IHE Experience Sessions website. And that's all the nice things that IHE Catalyst is going to do, which is more or less the continuation of the work that IHE Services is doing. So nothing's going to change. It's going to be more stable, more sustainable, and we'll be able to provide those services in different time zones at a global scale. So the idea is to create multiple teams, multicultural teams, obviously, that are able to provide support to any request around the globe. So I think now it's a time to pass the floor to the participants. So I will stop sharing my screen and give the floor to the first participant, which is Eamon Coyne and Ed Harte from HSE. And then just to mention them, we will have a presentation by Thierry from INS in France, and from Greece, from Athanassios Kelepouris. I made a mistake again, it's his name. Sorry for that, Athanassios. I will correct it. And then from Switzerland with Martin Smock from eHealth Suisse. And then we have a large team from Gabon who recently made their own Projectathon in March. So thank you very much. And Eamon, the floor is yours.
Thank you, Alexander. I can't believe you made a mistake on the Greek name.
It's really an yes.
About the names.
I think the L and the P is very close in my laptop. But as you are presenting, I will correct it.
I'm only teasing you, Alexander.
I know.
So can people see my screen?
Yes.
Perfect. Okay, so thanks, Alexander, for the introduction. Eamon Coyne is my name, and I worked in our National Health Service, Health Service Executive for the past 17 years. I got involved originally as a programmer and local implementations of eHealth projects, and then regional project implementations, then national, and then cross-border projects. So Ed, I'm delighted to be here to speak to you and honoured for the invitation. So thanks to IHE for giving us the opportunity and to talk about the Irish experience in terms of Projectathons. Ed, do you want to do a quick intro of yourself to the rest of the group? Can't hear you, Ed. Okay. Ed can jump in if he resolves his audio issues. So, Ed is a member of the HSE like myself, and similar to myself, he's worked for 17 years in the HSE, and he's also a member of the Enterprise Architecture team. So we work for the Office of the CIO, Chief Information Officer, which is responsible for delivering eHealth in Ireland on behalf of the Health Service Executive. And Ed has experiences in our national projectathons also. So if you forgive me for a definition, but if we look at eHealth interoperability testing, is the ability of different information technology systems and software applications to communicate, exchange data, and use information that has been exchanged. So testing is the backbone to interoperability. We know that. So in terms of our relationships and the work experiences that we've had with IHE Services, the Interoperability Challenge, I believe it was the beginning of 2018 that we got involved in, is the cross-border use case. So just in case people aren't familiar with the eHealth DSI services that Alexander mentioned in his lovely presentation, is the eHealth Digital Services Infrastructure. They're digital health services that are implemented on behalf of Connecting European Facility. And one such use case or two such use cases are the sharing of patient summary and e-prescriptions cross-border as per the EU Directive 2011/24/EU. So this diagram calls out the interoperability challenge. So it's based on unplanned care. The patient presents to the healthcare professional in the country of treatment. So somebody that's abroad on holidays presents to the doctor in an emergency department, for example, is feeling all well, has shortness of breath. The healthcare professional can log on to this eHealth DSI digital infrastructure, request via their national health infrastructure through the national contact point, coming across into country A, country of origin, and request the patient summary. In this case, it's subsequently returned to the healthcare professional and translated. If it's, for example, I presented in France to a French emergency department, then my patient summary will display in CEA level 1 as a PDF in English, but also in a level 3 CDA document in French, so that the French healthcare professional can understand it and can see my allergies, my medications, my past medical history, and so on and so forth. So this and the e-prescription use case is when somebody's abroad, again, an unplanned encounter, has a repeat prescription. For example, my wife is slightly asthmatic. She forgot her inhaler. She can't find it. She presents to the pharmacy in Spain. It's quite muggy. She can't breathe. And she presents to the pharmacist and says, identifies herself to the pharmacist. The pharmacist logs on to the platform of the National Health Infrastructure, sends the request back, and sees that my wife has a repeat prescription for Ventolin inhaler and can dispense it at the point of care. So those are the two use cases, and this calls out the levels, the application layer, the messaging and transport layer, and the networking layer that have delivered these services. So how we did approach that with the help of IHE Services is the use case driven approach. So the use case driven approach is defining use cases and the prioritization plans of the eHealth strategy, objectives of the nation and region. From the use cases, then we design the interoperability infrastructure and specifications based on IHE profiles, and then to define the testing strategy and identify the test plans and test methods test cases, test tools, and test data. This allows to support project teams to procure products or solutions for their eHealth projects, whether it be telemedicine, national, regional, EHRs, or replacements of products in hospitals. It's quite broad in scope in the way that you can take the use case driven approach, obviously. So for us, it was hugely beneficial to implement this approach. And this was also documented and well proposed by our colleague Alexander and his colleague Kelepouris, just to acknowledge that. So what we done was at the beginning of 2018, as I said, when we started to work with IHE services, although the use cases are called out in the previous diagram and the interoperability challenge to share the information, the clinical information for cross-border purposes, you have to localize them in terms of projectathons to the national situations. So what we done is we had 2 workshops in Q1 2018. We brought in stakeholders from the health service executive, so all of our relevant partners in helping us deliver digital health. We brought in academia, we brought in standards bodies, and myself with the help of IHE services, Alexander and Krima, and Charles Paraso, we set up workshops. We brought these people into the room and we used the use case templates to identify who the technical actors were and how we could localize the use cases from an Irish perspective. So that was hugely beneficial. Then once we had the use cases defined, we started to look at the architecture. So we started looking at architecture workshops. And again, we brought the same people in. Once we had the use cases and the architecture identified, then we started to bring in a little bit more the technical representative, and the group got a little bit smaller. So we started looking at the interoperability specifications to, as Alexander had said in his previous slide, to inform what the tests would look like. So we had an enterprise edition of the Gazelle test platform installed. So as Alexander said, that's the preferred thing for national strategies, is to have that support and validation from IHE services. And when we get that, you get not the vanilla, but you get the standards at the enterprise level as defined. But then the localization takes place when you look at the interoperability specifications and you start to extend them for the Irish specifications. For example, the PDQ query for Ireland would be specific to the patient identification specification that we developed to return the IHI, which is the individual health identifier. So once the test tools were there with the Irish extensions, that gave us the capability to start participating in projectathons. So unfortunately, we couldn't have the projectathons face-to-face. They were done remotely, but again, with great success under the supervision and guidance and help of IHE services. So we had one last year, the first one in summer of last year, and then at the end of last year, we had a second projectathon. And we're planning, because the specifications are becoming more enriched and there's different stakeholder systems to come up on board as part of the project. We have projectathons planned towards the latter part of this year. Sorry, pardon me, I skipped this slide. So the architecture that was derived, although it was facilitating the cross-border use case, which would appear to be quite narrow. So with the help of IHE services, the architecture that we did develop was an XDS Besed Architecture. So it facilitates obviously cross-enterprise document sharing, clinical documents. So what that afforded us is that horizontal backbone to the vertical clinical system. So we can see in the upper left-hand quadrant here, the national contact point, the conduit for exchange of information for cross-border purposes. But then we can see as we go across in the middle, the national prescribing, and the architecture that we derived and devised is core and central to the national prescribing project that's being developed right now. Immunization, electronic health record, chronic diseases, maternity, the list goes on. Then once you build up the clinical coded rich data documents, that obviously affords the basis for the analytics and the administrative side. Is there anything else I would like to say on that? Yeah. Then the roadmap is once we build up the XDS infrastructure, that then we have the FHIR repository, which affords us more coarse, granular ways of reporting and analyzing the XDS data. And there's MHD, there's plenty of profiles in terms of mobile sharing of that information. So the interoperability specifications that we developed, we had core ones, which were patient identification management, patient summary, description, a central one to sharing documents and security and privacy, and then we had the ones around the clinical content. So we developed the architecture, as I said, by IHE and HSE. developed the interoperability specifications. They covered the fundamental elements of safe, secure clinical data exchange that form the basis of the testing. The specifications can also be utilized by other national cross-border use cases, and they underpin the architecture and in essence form an interoperability framework. So again, although we just were looking at the cross-border use case, by developing which there wasn't anything that was mature enough or robust enough at that particular point in time, it afforded us the opportunity to help the national IHE develop the API for the retrieval of the individual health identifier based on a PDQ query, and we helped them with the PICs as well. So not only did we facilitate the cross-border use case, as I said, we greatly assisted the national. So it's based on the Gazelle, as I said, the conformance of messages supplied by a system, conformance of information exchange, conformance of systems to the relevant interoperability standards. So that's just a screenshot of our test platform and the URL that it's available at. In terms of the projectathons, as I said, we had 2 of them. We had the transmission of the patient summary. What it saves that the benefits that we found, I'm not going to go over the top part of this slide again, it's just repeating information that I've said already. But what I will say that the benefits that we see in the national projectathons are it saves time for all the project stakeholders during testing and for using during field deployment. It saves money for all the project stakeholders for corrections made on the fly during the test event, and it gives users a higher level of confidence and reduces the clinical risk. So with the help of IHE services and some of the team members that were there, Angel, Thierry, and there was great transformation of knowledge within our own team in the Projectathon process. It not only did they bring the system interoperability, but also brought the human interoperability because it got the relevant stakeholders and systems that would be under test. The NCP was the conduit, the mechanism to share the information, but then obviously you have the national infrastructure to support the exchange of information. So it brought about a great kind of community spirit by hosting the Projectathons, as can be seen in the Connectathons. It also raised the skill of our own technical team, so Ed can testify to that. And also we're very proud that Sandra, who's a colleague of ours, and she's in Sandra Ryan, who's in Zelensky, is actually a monitor now at the Connectathon that's going on in parallel to this session. So we're very proud to have Irish representation at the Connectathon. So hugely beneficial to the national projectathons and also to promote the use of the test tools within the Irish ecosystem. And again, forgive the plagiarism, but these the sources of these images are from the link that's there, so they're not mine. So thanks to IHE for the nice diagrams, and that a picture paints 1,000 words. These diagrams have been hugely beneficial when demonstrating the capabilities and the benefits of the test tools to the executive audience domestically. So another example that we use the test tools for, we know the benefits of Projectathon, so if you allow me just say how the use of the test tool for the Projectathon was the original use case for the test tools. We also have a national messaging health broker, which is called HealthLink. The standard that was used there was HL7 2.4. So it was a first for our Ireland and the enterprise architecture colleagues in conjunction with Access to Information, who are the custodians of the national messaging broker. We worked with IHE in this, and we used one of those tools, the authoring tools that Alexander mentioned earlier, IGAMT. So we've done up the messaging specifications, which mirrored just the textual documents, which called out the HL7 2.4 messaging specifications for discharge summaries and lab results and so on and so forth. So we authored that up in IGAMT, and then we were able to upload the information that we used in IGAMT to create the HL7 2.4 validation. So we had our own localization that would allow anybody that was coming on board, just say for example, it was a hospital and they were sending a discharge summary from the hospital back to the GPs, that it would allow them, as they were onboarding that particular service, to test against the HL7 2.4 and upload the document and ensure that it conformed to the standard, or if it did fail, as we know with the test tools, it would come back and give the reasons why. So it gives detailed feedback to the vendors or the hospitals or whoever the developers and the implementers are. We have increased governance and transparency, performance is achieved, and then we know it gives us future proofing in terms of people that come on board as we develop more and more of the specifications, and that we have that greater sense of confidence. So that was another example of using test tools for another use case. In terms of the bigger picture, because at the end of the day, the health service executive is a government body and it uses public funding. So when eHealth projects go out, we have to adhere to the tendering process. So the health service executive defines the requirements for a project. The interoperability specifications and the test plans are based on identified standards. Again, going back to the interoperability framework that we have there, and you can tweak those interoperability specifications to suit the use cases. The call for tender goes out. In terms of the vendor, they're releasing their product, and they participate in the tendering process. They can come onto the test tools. They can check if they're conform to our patient identification specification, our capability to share patient summary, for example, cross-border, our capability to share lab results. And if they fail, then they have to develop their product to achieve the interoperability as required as per our specifications. If they fail, they keep going until they achieve conformance. When they achieve conformance, then they can include the passing of the test results and include it as part of their tendering proposal. So again, this is kind of doing the hard work in advance of the implementation, some of the hard work in advance of the implementation of a particular product, and ensuring that they achieve the required interoperability in terms of the Irish ecosystem. And again, some of the benefits are called out there on the side as well. And one of the main things is greater efficiency of operation enables enhanced patient care, because at the end of the day, exchange of clinical information gives that governance and confidence. So this is an example of an interoperability function to test. So we'll just say, for example, it's a requester of an imaging report. So the use case request by radiology examination, the interoperability function is the requester of an imaging report. The service is the same, the optionality, the technical actor is called out the order placer, and then the profiles and transactions, IHE schedule workflow, and the interoperability specifications. Just say, for example, I'm giving an example here, HSE specifications for an EHR. So in the tendering specification, you can say the products or solutions that are referenced in this particular proposal for a particular system. In order to achieve the interoperability function, requesting of an image shall implement interoperability requirements as described in the HSE specifications. And then the sample text for the tender evaluation, the product or solution is conform the interoperability requirements as described in these specifications for this interoperability functions. And they can say yes, and as I mentioned earlier in the swim lane diagram, include a yes or no answer. In terms of evolving our test tools, and the plans is to do that to a certification authority, is start with specific use case and develop the test tools. Once the test tools are proven to support the requirements, the service the foundation to mature to a certification test lab, and then the longer term roadmap is to put HSE eHealth Ireland on the validated systems that come on board. So again, the interoperability framework specifications 2018, 2019, the test platform is deployed, 2021, national Projectathons to deliver cross-border services. And then from now onwards, embed the test tools into the procurement and implementation lifecycle. And also national Projectathons become more and more relevant as each of the interoperability use cases come up. And 2023 is that similar to what Alexander was mentioning earlier on his slide, is 70/25 certification standard and a test certification lab, and resourced by the HSE staff, and obviously with the support of IHE services to have that enterprise validated version of the test tools. But not just that, the earlier ones that I've given, like we want to Projectathons, all of the good work that IHE are doing at more of the Connectathon level, similar to the European Commission model, for utilizing the test tools for Projectathons. The plan is to expand it to even wider out, but we have a good foundation based on the Projectathons that we've had, and they were very successful. I didn't get into using Art Deco or the authoring tools that we done for the CDA templates, but just wanted to kind of give a feel from the Irish perspective, the benefits of the test tools, the benefits of working with IHE services, and the benefits of embedding interoperability standards and vendor agnostic. It just levels the playing field and allows the sharing of information, clinical information domestically and cross-border. So the last slide I have is, and just to call it out, is like with the collaboration that we've had with IHE, is they have a highly skilled professional team, wealth of experience from other projects. You've seen the slide for Alexander there, 25 reference implementations of the Gazelle test tools and supporting test tools across the globe. collaboration with different stakeholders in different departments. That was that community spirit that I spoke of, with a sense of achievement when we were working on a projectathon, or indeed as the monitors are doing right now with Connectathon. Huge knowledge sharing with the Irish team. That's one of their big benefits. Like Alexander said, when the test tools, the enterprise edition, and it's funneled up anything that's found or any developments that are made in localization of national implementations, it's all shared back up so people can benefit. And that's similar to what we were trying to achieve with the Europe project that Ireland participated in as well. So international best practices and test tools are embedded in the Irish-IHE ecosystem. So we're all very, very positive over the last couple of years. But I suppose what's hindered our progress a little bit for us, and it's the same for every member state, it's the same across the globe, is the COVID pandemic and the investment of that. It seems like everything to a degree was put on pause and stalled our progress. So, but like we still very much believe in this vision and wholeheartedly behind it, as is Ed. And we just want to acknowledge IHE for the support and all of the great work that we've done to date from an Irish perspective. Now, Ed, I'm not sure if your audio is back. If you'd like to add anything to what I just said, Ed.
Yeah, thank you, Eamon. Yeah, I was unable to unmute myself because in case I'd interrupt your flow. So thank you, Walter, for sorting that out. No, I don't want to keep anyone unnecessarily, but just to add into the last slide that the working together with IHE, the knowledge sharing that is there, the genuine feeling from IHE that they're part of the team and they want you to succeed. Just to touch on what Eamon said, the human interoperability that gives you, along with fulfilling your goals from system interoperability, cannot be underestimated. And I'm genuinely so happy to be here among all this team and being given the opportunity just to speak to you and to listen to everyone and as we share knowledge in this community spirit. Thank you, Eamon.
No worries. So thank you, and thank you, Ed. And for Amiga, thank you in Irish. So thank you for listening. I hope it was gave you a good idea of what we're doing in Ireland, and look forward to the next presentations. So if it's okay, I'll stop sharing and pass back to Walter and Alexander, if that's okay.
Thank you very much, Eamon and Ed. Before passing to Thierry, is there any specific question to Eamon and Ed related to the Irish experience? We can also use the chat at any moment to address questions or comments so that we can use them also for the discussion. Okay, there is one question from Esther, Eamon, on the chat box about the Irish, yeah.
It means thank you in Irish.
Okay, great.
Yeah. Okay.
Okay, so
no questions, I'll stop, Alexander.
Yes, thank you.
No, thank you.
So I think now it's time to move to the French experience. I think it's a little bit more diversified view. INS is doing a lot of things by themselves, so we are keen to learn how they can accomplish all that, and if they have some very good vision for the future and good steps and some good advice for the rest of the group as well. So Thierry, the floor is yours. Thank you very much for being here.
Yes, thank you, Alexander. Good morning, everyone. So I will speak about Projectathon in France, and first a little introduction of who we are. Well, we are INS, Agence du Numérique en Santé. We are the French eHealth agency. We have been created in 2009. We have the responsibility of promoting, developing, and sharing information system about health. So quite huge program. We try to contribute to improvement of coordination, efficiency, and quality of care. And we are member of HL7 IHE International and also HL7 IHE in France. So we are involved in IHE at the national France and also at the international level. And we learn a lot from IHE. We have three main missions. The first one is to regulate, and that means for us two missions. The first one, we have to improve interoperability in France. So we have a interoperability framework, and we have also security regulation in France. Patient identification, identification also of healthcare professionals. So we have many things about interoperability and security. The second mission is a classical mission in computer system, is to lead a national eHealth system. So it could be a secure email system like MS Santé. It could be an IT system for emergency unit, like in France, the SAMU, same as the paramedics in the US, and adverse event reporting system. So many things. And the first mission and last one is quite very important also, is to spread up healthcare usage. So we have a team who, to support regional health agency, will deploy our national system. So regulate, build, and deploy. We have in France a French interoperability framework. The first version was in 2009, so quite huge history. It's based on IHE profile. Most are based on IHE profile. Some are based only on health level 7 on DICOM standard, but most are based on IHE profile. We are involved in IHE, especially in ITI and PCC domain. We are also trying to monitor other domain like QRPH or radiology domain. We are also monitors. Some of our team are also monitors at North American and European Connectathon.
Thierry,
So
I'm sorry, can I interrupt you for a second? Are we supposed to see slides?
Oh, yes.
We don't
sorry,
see your screen yet.
I have not shared my screen. Sorry for that.
Oh, it's okay. Just wanted to make sure.
Okay. So, sorry. Hope you can see my screen now.
That's perfect.
Okay.
Great, thanks.
Okay, sorry. So we have a interoperability framework. So we are involved in ITI, PCC. So we are also monitors at North American and European Connectathon. And we have two main systems in France at a national level. The first one is called a DMP. It's a personal healthcare record. It's a national XDS repository of CDA document. We have more than 10 million of DMP open actually, so it covers only 20% of the French people. We have 120 software who are compatible with this system, who are compatible with XDS, with this XDS repository. And you can access to this repository with a mobile application and a web portal. So you can see on the left a short screen here of a system who can pass a CDA document of biology or for a biological report, and you can see it's a screenshot of a methodology report on the second slide. The second screenshot. It's a mobile application. So we are the first application of Projectathon is this DMP. The second one is exchange of CDA document also using MS Santé. MS Santé is a national secure email system for healthcare professional and now also for patients. It's exchange of CDA document using IHE XDM. So we have developed CDA document the CDA document, most are national extension or are national extension of already known CDA document from IHE, like a biological report, breast cancer screening, medical synthesis, reimbursement data. It's quite specific. Immunization content, anesthesia report, and we are planning future work on radiology on European project. I've just missed to say that the DMP, so the National XDS Repository, will be connected to the NCPH, so the European infrastructure for sharing a document, and especially two kind of document, medical synthesis and e-prescription. So we are doing Projectathon on these two main use cases, sharing and exchanging CDA document on DMP and MS Santé. We have already done three Projectathons. The first one was in April 2029. It was in your European Connectathon in Rennes. This is a screenshot of this marvelous place in Rennes during the Connectathon. So we test a biological report, communication diary. It's a specification in FHIR. So we have specification in FHIR and also specification in CDA. The second Projectathon was in November. Of the same year. It was during the we have a National Vendors Day in France. We test medical synthesis, and the third Projectathon was in 1 year after, in November 2020. It about 18 interoperability profile. So 10 years of DMP, 10 years of MS Santé, 10 years, more than 10 years of interoperability framework and free Projectathon. The last Projectathon was in November, and it was quite. It was a very huge success. I think it was virtual, like in many countries. It was 2 days only, but 1 month before. So we organized a pre-Projectathon to train all the vendors, and 1 month after, we also continue to validate all the tests. So usually we say 2 days, but it's in reality 2 months of Projectathon. So it's 23 vendors. You see all the screenshots. Most are national vendors, so small vendors. We test 8 interoperability profile from geological report, medical synthesis, hospital discharge, emergency report, telehealth, agenda, and communication diary. Most of these profile are actually national extension of IHE. Some are specific, like the agenda or communication diary, and are based on FHIR profiling. We have, during these 2 days, we passed 130 tests in Gazelle. We have 12 monitors from INS during 2 months. So it's quite a huge program to organize a Projectathon. We have a lot of message also dedicated to support vendors. So very big organization. For the tooling, we use 2 kind of tooling. The first one is a tooling about profiling. We use Harte and Simplifier. Harte for CDA and Simplifier for FHIR profiling. And we are publishing our FHIR profile on Simplifier. And we are also using Gazelle for interoperability testing. We are sharing a national platform of Gazelle for us, INS, and also for HL7 and IHE France, an association called Interoperability. So we have one Gazelle platform for many organizations, for 2 organizations in France. And we have on this Gazelle, we are testing CDA, Fire, XDM, XDM profile. Next step. What are the next step? Next step will be the 4th Projectathon. We are planning the 4th Projectathon for December or January, and next step will be also labeling and certification in France, and also directly funding of some of the vendors. So we are developing and we are progressing on using IHE methodology for testing. We are always try to be connected with IHE. We are always try to do something in coherence with IHE and with the international level. That's all for France. Thank you. And if you have questions, do not hesitate.
Thank you very much, Thierry. It was very informative and very nice to hear that you had a so large Projectathon last November. I hope that the next one will be even larger. Oh. So any question directed to Thierry or something like us, more details on what he presented? Okay. So then I would like to pass the floor to Athanassios Kelepouris from Greece. To
Alexander,
present...
there is a question also, but I sent it to Thierry directly. So
okay. So I didn't see that.
Okay,
you sent it directly to him, so he will reply, I guess.
Okay. Our strict is a compliance to the imperative framework and with incentive penalties on hardware. And penalties, do you have an organization hosting governance? We are hosting the governance. For the 3 Projectathon we have done, there is no special funding, there is no penalty, there is nothing. It's only Projectathon for training vendors. But we have a more, with the certification, we will have no penalties, but we will have incentives. So, and direct funding of some of the vendors. So we have special, we are working actually on criteria to fund directly the vendors. We are still working on that. It's quite complicated, but we are working on that. I think the 4th Projectathon France in December or in January, it will be only also training for vendors.
Thank you, Thierry, and thank you, Athanassios, for the question. So if we don't have any more questions to Thierry, I think that Athanassios, you can take the floor and make your own presentation.
Okay, thank you, Alexander. I'm trying to share my screen. I hope I will make it. So can you hear me, and can you see my screen?
Yes.
Yes, thank you. I would like to first of all thank IHE-Europe for the invitation and the opportunity to share with other collaborators our experiences, and for the opportunity to present some facts about Greece. My presentation will not be technical per se, but it will be just a sharing of our experience so far. So my name is Athanassios Kelepouris with 1 S, because this is how it's written, but it's pronounced with 2 S. because it's Athanassios and not Athanassios. So anyway, I work at the Ministry of Health Greece, the Digital Governance Service, where I work as the director. And my short presentation will revolve around a project that we are running since the early 2020. It's the National eHealth Interoperability Framework, and it's a project that is very promising for us because it's actually the first time that we are trying to make a systematic effort in order to bridge some interoperability gaps that trouble the, let's say, the health system for many years. And although we are familiar with IHE and the profiles and the tools that they provide, I don't think that so far we have managed to make a complete and comprehensive effort. So this is, I believe, a huge opportunity for us. So a few things about the project that I'm talking about. Its main goal is to support the management of health data and health services, which of course are very important for the improvement of the results of treatments as well. Also, it aims at the harmonization of the process of exchange and use of health data with the use of European and international best practices, and of course standards and integration profiles that have already been used in other cases. Also, it's one of the main goals is to support the universal and productive operation of the national EHR system, and also facilitate the provision of health services for both professional and citizens. Other aspects and milestones of the project tries to provide a series of documented proposals for the digital transformation of the governance of the domain of eHealth, giving emphasis on, of course, the creation of a national framework for interoperability, which our goal is to prove itself to a very important pillar in the digital health strategy overall. So the project provides the roadmap for implementation of an interoperability framework that consists of more than 10 use cases in this so far, and it moves on and analyzes the fuller implementation for a first for one use case scenario, which is the exchange of laboratory results at the hospital level, and also at the level of primary care. The project provides a detailed specifications for, as I said, a selected use case, and it emphasizes on the design of also on the design of a national interoperability testing framework. So a few more words about the important milestones of the project. It's the organization operation of test tools to the specifications that are created so far with the help of all the community that is working in this area, using, of course, certified tools. It's the a very, of course, important milestone is the testing event that is on its way on July, the Projectathon, and overall the project is trying to provide support in order to support the governance overall in the digital health domain, and apply national standards that are already tested in other cases. So it's a project that we have managed to bring with the support of the DG reform and the structural reforms support service, and of course with the valid contribution of IHE and the techniques and tools that they provide. So some achievements of the team effort of the community so far, in order to try to see the magnitude of the effort. So far, we had more than 40 administrative meetings, more than 70 technical subgroups meetings. We had, I believe, 2 training sessions with more than 100 participants in each session. So far, we had the participation of over 100 experts in the field of digital health and other relevant fields. And also we had more than 25 meetings for the use cases and the governance model that was necessary for this project. So as I said, we are moving towards a very important milestone for this project, which is the Projectathon, which will bring all the work that has been done so far, all the specifications that took many hours to write, and all the stakeholders that have worked together and followed a culture that maybe was not there so far, but it's another very important aspect to this whole effort, and trying to use a new framework and tools that we have not actually used before in such a way. It's the new culture that is brought to the table for many stakeholders, and that they make them work together and form a new community of practice, which is very strong and which is very important for not only for the projects that are running right now, but also for the projects that are coming in the future. And for Greece, of course, there are projects that are coming through the Resilience Fund from the European Commission, and we're talking about very important projects that will really need the pillar that I was talking about, which is a solid national eHealth interoperability framework. So to take a short overview of all the participants of the community, and especially the vendors that are a very important part of this community. This is a, let's say, picture cloud, if you will, of, I believe, most or if not all the vendors that participate so far in the project and in the upcoming Projectathon, and they have expressed their interest and are actively involved in the project so far. So as I said, so far our experience, what has it brought so far, and what have we accomplished? I believe that there are 2 important things. First of all, it's that a strong community of practice has been born out of this whole effort with the National eHealth Interoperability Framework and with the collaboration with IHE-Europe. As a community that has been sharing common interests and common vision about supporting the integration of the exchange of patients' data and of course systems that support this exchange. And the other aspect is that the National eHealth Interoperability Framework has proven itself as a very important pillar in our national digital health strategy. I believe these are very 2 important aspects of the end results, if you will, of the work so far. So, as I said, the work is important not only for the current projects, but most of all, it's important for the projects that are coming. So this is an overview of the Greek proposal for digital health under the Recovery and Resilience Plan. It's called Greece 2.0, and some of the main projects that are coming involve the national EHR system and its reformation, let's say. It's a national digital program for cancer management. It's the strengthening of hospitals and their digital maturity. It's the expansion of telemedicine and the national telemedicine network. Also, it's the digital transformation of the National Health Fund, and maybe even more projects that will fall under those main areas. So you can see the budget. We're talking about a strong funding and a strong opportunity for Greece to make some really good things happen. And the timeline, which is takes about 4 or 5 years. One example, one main area of work is, of course, the national EHR system, and some sub-projects that will fall under this basic category of action is the creation or reformation of a central document repository, of a central terminology infrastructure, central imaging repository, of course, the National eHealth Interoperability Framework and its expansion through the deployment of new use cases, which are necessary, the reformation of national EHR system and its expansion in order to try to exchange data from every point of care, the interoperability for lab exams, interoperability for hospitalizations, for medical images, and even mobile apps for the citizens. You can also see the budget and the timeline for this effort. So this is a picture depicting some of the interactions that are happening, considering one of the key actors that work with the Ministry of Health and operate some of the biggest systems in Greece regarding the exchange of health data. It's IHE, which also has experience in the EHDSI project and performs as the national contact point for eHealth as well. So you can see all these transactions here and the possible use cases that will need to be examined, addressed, and generate specifications, etc. And they include all the actions that I mentioned before. So we have talked about the importance of the community of practice that has been created through this procedure. So maybe some facilitators that are necessary for this community in order to survive, to grow, and to make to succeed in even better things in the future are the existence of sufficient organizational model, which includes aspects of participation, structure, management, support, etc. Of course, it's the political support and collaborations that need to be there in order for things to happen, and things to happen in a way that will be comprehended and agreed upon with every involved stakeholder. And of course, the funding and the resources available, even if we are talking about heavy funding or not. I mean, we have used tools so far that are free, but they have served very well the works of the interoperability framework. Of course, the legal status of the community, the value that they bring to the table, and also the sustainability, which will require in the future, of course, the expansion of the use cases that we have worked on so far. And again, some interoperability use cases that are candidates, let's say, for even more work in the future regarding also the Recovery and Resilience Fund. It's the National EHR system, and the exchange of exams, hospitalizations, medical images, etc. It's the National Cancer Archive, the electronic prescribing for inpatients. That's something that has not been fully deployed yet. The use of DRGs and their incorporation in the works, the expansion of and fuller deployment of electronic medical appointments, the expansion of the telemedicine network, and many, many more. So that's it for me and the experience so far. Although we are a late, let's say, adopter of this whole thing, I believe that we are in the right way, and we're hoping for good things in the future. Thank you.
So thank you very much, Athanassios, for the presentation. Any questions to Athanassios? Okay, so then I would like to give the floor to our next speaker, which is Martin Smock from eHealth Suisse in Switzerland. I guess, Martin, there's quite a lot of years of experience in Projectathons, so we are really hoping for your inputs in the discussion. The floor is yours. Thank you.
Thank you very much for the introduction. Yeah, Switzerland is, maybe I start with the first slide. So Switzerland is in now 15-year ongoing process of establishing an exchange infrastructure, national exchange infrastructure for all type of medical information with the involvement of the patient or the healthcare professional, hospitals and so on. So although Switzerland is quite a small country with 7 million citizens, it's nevertheless a collection of communities, each implementing IHE XDS affinity domain. There's a small picture on the right side showing that's more or less regionally, but there are also some cross-regional communities for special use cases like medication and so on. And all these communities are communicating cross-community, exchanging data from the different regions, and internally and in the communication with the other communities are enforced by law to use IHE profiles with HL7 CDA or file exchange format. The whole process was live at the beginning of this year, and we started with infrastructure exchanging imaging data and PDF data mostly. And we are now in a rollout process to step-by-step extend it for special use cases like medication, vaccination, and so on, using standardized exchange formats. All the requirements we put on the implementations of the communities as well as the primary systems which are connected to the communities. They are specified as IHE national extensions and or FHIR implementation guides depending on the problem, or CDA implementation guides we also maintain in Harte, as you saw before. And one of the important part of the overall release management or rollout process for specific use cases on this national infrastructure are the Swiss Projectathons. All the processes we implement are tested first on at least 2 different Projectathons. And you might get an idea how we do that. On the next pictures, it shows a simplified release and rollout process we use for this whole national infrastructure involving all the different communities. So we collect issues either from Projectathon or from requirements we have from organization or other stakeholders in Switzerland. We assign them to the release, we do a risk analysis, we plan the release, we do the specification as a national extension to IHE profiles, or write the implementation guideline in draft versions. We go to a public review phase, and the most important part for this talk is we do one, or we do at least 2 tests of Projectathon. So it's more an iterative process. So we test it at the Projectathon. We find new issues. We find the specifications. We go to a public review phase. We test them at the Projectathon. And if we are fine with everything, all the vendors, and so have no problem, if we don't find any interoperability problems, we finalize that, and then we go into the legal process. We adopt the legal regulations, national extensions, implementation guidelines, and the legal texts. We have, as Alexander mentioned in his introduction, we use Gazelle not only for the Projectathon test, but also for a certification test system. All communities must run every 3 years through a set of no-peer tests to ensure that they fulfill the interoperability requirements from our legal regulation. And there's an audit and certification process on data privacy, data security, and conformity with the specification. And we finally roll out. So most is writing, testing, certification, but the Projectathon is one of the most important parts, because there we check if all our writings and specification work in practice. We are in close communication with the vendors during the Projectathon. It's a very good climate to solve interoperability problems and to improve the specifications. We opened up issues which resulted in change proposals for the underlying IHE profiles, and so on. So we have very integration, a very important part in the overall release and rollout process for our national health record. The first Projectathon was we held up in 2017. It was originally in Bern. The next one we used the opportunity to make the Swiss Projectathon as a part of the Europe Connectathon, where we had a special section in Den Haag. Then again, a Swiss Projectathon in 2018. Then again in Rennes, we used the opportunity to make it as a part of the European Connectathon. And then we had 2 Swiss Projectathons in 2019 and 2020. So it's established now that we have a 1-week Projectathon every year in Bern. And in addition, we do special use case testing, either in Swiss Projectathons. Example, if you want to solve specific issues in medication or vaccination, we do a few smaller Projectathon, or we join the Europe Connectathon. We use the opportunity to make it as a part of the Europe Connectathon. We have our own instance and our own tests. We have to test our national extensions and our own Gazelle instance. And we're working closely with IHE services and Kelepouris to improve that and to extend that to get a good test coverage. So one of the important questions is how many companies enjoyed the Connectathon. So we typically have, at the beginning we had 25 and 23. It's now going down, which is natural because more and more vendors who were first interested now see if that now verify if it's a business or not for the future. We typically have 20 participants and 80 persons, 20 companies, 80 persons. The last Projectathon was a little bit slower, had a lower number of companies because of the COVID issues and people could not travel. We need quite a big stuff for monitors because we have lots of national extensions to test, and they are all tested in group tests, which are quite hard, or the effort from verifying group test is much bigger than for the no peer test. So we have typically a large team of monitors and then six to eight people from the technical support from IHE services and care about to keep our system up and running to the Projectathon. Participants typically come from Switzerland, but also from France or Poland and from Germany. That all depends on the without going into the details, the overall, so to summarize, the overall experience with the Swiss Projectathon is a very, very positive technical program. So we generally don't face any technical problems. Gazelle is up and running. The tests are, the test coverage is quite good now. The system is easy to use. People are used to work with the Gazelle tools from the Connectathon and from the Swiss Projectathon. The participants are very engaged. That's one of our big benefits we have from the Projectathon. They give valuable input how to improve our specifications and regulations, and they participate in finding solutions for interoperability issues. So during the Projectathon, we often have discussion rounds, people sitting together and finding solutions for specific problems. And since the experience is very good, we are planning to have an annual Swiss Projectathon every September, and the next one is planned for this year. And we are currently in preparation. We always put the Swiss Projectathon with a motto or with a special focus. This year is a mobile health integration, so integration of mobile health devices and native mobile application, and its vaccination and the medication. Yeah, thank you very much. That was all I prepared for this session on this.
Thank you very much, Martin, for sharing your experience on Switzerland and especially on your next plans. Any specific questions to Martin? If not, I think we can go to the last presentation of today, which is from the Gabon eHealth project. So I would like now to ask Constantin Béranger to present the Gabonese case.
Okay, thank you very much. I will share my presentation. Sure. One minute. Sorry, 1 minute. I don't see my presentation.
Okay, we can see it now.
Okay. Good morning, everyone.
So you are not sharing the presentation now, you're sharing something else.
You see it?
Yes, now it's okay, thank you.
Okay.
You are muted, so please unmute yourself.
Just 1 minute, I will restart.
Okay. You are muted again. Now it's okay.
Okay, good morning, everyone. On behalf of the eGabon project. We are very happy to be here and to take part in these important events. We will present to you a brief summary of the work we have done for the realization of the Projectathon carried out within the framework of the selection process of the consortium, which will have to accompany us in the establishment of the Gabonese health system, which the technical support of IHE services for interoperability issues. Okay, you have in this slide a part of eGabon project team, Mr. Emmanuel Asumuka, eGabon CIS project coordinator. Mr. Asumuka is assisted by two functional assistant coordinator. Functional, Mr. Jean-Donatien Tsokati, functional assistant coordinator of eGabon CIS project. And Mr. Zengi Badinga Mwanda, technical assistant coordinator for the same project. Mr. Doyon Boris Mouke is a director of information system at the Ministry of Defense. And you have me, Béranger Constantin Sa, head of the studies unit of the same project. Okay, so in September 2020, the eGabon CIS project launched a call for tenders for the acquisition of turnkey hospital information and decision support system on behalf of the Ministry of Health and Military Hospitals. Following the interoperability framework that we define with the technical support of IHE services, we thought it was useful to ensure that the consortium that responded to the call for tenders offer us solutions that respect our framework, our interoperability, national interoperability framework. And in particular, all the specification in terms of IHE profiles, we launch as I say that call of tenders to respect these many specifications. Projectathon, as we know, is a test session dedicated to a specific deployment project using a set of IHE profiles in the interoperability specification that we did. The Connectathon gives suppliers the opportunity, as we know that, to test the interoperability of their products in a structured and rigorous environment with peer suppliers. So you have in this slide the different steps we have made to realize our Projectathon. We have 6 consortium. The duration, as you can see in this slide, of this event starting in 1st January 2021 to end in the end of March 2021. We did the online Projectathon in 3 days, 29, 30, and 31 of March for 2021, for the year 2021. The language used are French and English. So in the first stage, we did the preparation of the test plan with the technical support of IHE services. We did the installation of the Gazelle test bed, the test tools and worker chat, system registration. The tests are performed intra-consortium. This is the particularity of our Projectathon. Our Projectathon, which was organized with many solutions directly proposed by the consortia, which participate of this event, to this event. We did also a recruitment of different monitors, 8 monitors in total, including the 3 Gabonese monitors. We did training session for implementers and monitors. Before the online Projectathon, we did an online pretest, and the result of this pretest are included in the validation reports. So after that, we did the online Projectathon, and in finish the report validation sent to the evaluation committee. You have in this slide the different tested profiles. We have selected these profiles because the use cases we have a choice in first time for the project. This use case, as you know, match with these profiles. So you are in this slide the different profiles which was tested for this event. Here you have the different states of a test instance on the participant and monitor side. As you know, as monitors, we were largely supported by monitors from IHE services and Caravel. It was a very good experience for us. Their support has helped us a lot beyond the training we received. And we plan to organize again at least one other Projectathon before the final delivery of the Gabonese health system, with the help of IHE services. Why not in a few years see a Connectathon organized in Africa? We can say that is our dream. In any case, this is one of our wishes. Thank you very much. We have finished our presentation, and we are listening to your possible questions. Thank you very much.
Thank you very much, Constantin. Any questions for his presentation? Okay, then. So I would like to thank all the participants and presenters for sharing their thoughts. Now we have about 15 minutes if we want to take them to be able to exchange some views on some points or matters related to Projectathons. So in the presentation, we had different views. Some of them were more technical, and some others were about the essence of teaming, the creating ecosystems and community of practices. I think all those points are important. For me, one thing I think we probably need to discuss, there are 2 points I would like to make questions and ask all of you, if possible, to share your views on this. So my first question would be related to the regulatory part of all this. So do you operate and have integrated the cycle of specifications, testing, and certification in a specific regulatory framework or a law? And if yes, please comment on that. So that's would be my first question. So any comments from the panelists on this?
Speaking for Switzerland, the use of the international standard and the IHE profiles is part of the ordinances to the Swiss law for the Swiss electronic health record. So the national extensions we write to IHE profiles, they are a part of the ordinances, and yeah, so it's legally founded to use the IHE profiles with our national extensions when participating to the Swiss electronic health record.
Thank you. Any other comments? Eamon?
Alexander, Eamon here. I hope you can hear me, and apologies if there was audio issues earlier. Just to ask Martin, we don't have it as part of a regulatory framework just yet, but based on my comments, the eHealth Swiss model is a great model. And I would like to ask Martin, has he any advice to other countries that wish to adopt the model they have in eHealth Swiss, and combining the technical and the legal? How did they achieve that? Because that's a challenge in itself, because the technical world and the legal world, combining both, is, if he has any advice to give in that domain. Thank you.
I don't know if I can give any advice on that, but I don't know how the situation is in other countries like France or who's trying, or in Ireland. So we have some, not all the vendors, especially for the primary systems and ambulatory systems or hospitals, they are happy to implement the standards. So that's one of the reasons why it is legally enforced. So it's not that it's welcome to the whole market to implement standard and to use the electronic health record. So in Switzerland, that was one of the motivation to legally to put it into a legal foundation that they have to do it to join. I don't know how the situation is in other countries, but the situation is not that all the vendors from primary systems are happy to implement the standards.
Okay, thank you, Matt. Thanks for the response. Thank
you. Thierry, would like to comment on this, and if there is any legal background in France? Or?
Yes, we are actually building our legal background in France, so it's quite early to speak about this. We plan to have a legal background in the next year, and especially because we want to have a public funding of vendors and also of healthcare professionals. So we are building our vendors on the, yes, Switzerland for us is a model also.
Okay, any other points or comments related to this regulatory part of integrating testing into some regulatory framework?
Is there any, Evert Sanders, IHE Netherlands, is there any news about the European Commission? We had those 27 profiles advised some years ago. Do they want to strengthen that advice?
So I guess that I think we have Karima on the call. Maybe Karima can say, and we also have Eamon, who is very much involved in the eHealth DSI, EMSEG discussions. From my part, I know that there are projects that are in the way of extending the different clinical documents that could be exchanged at the European level, because this is the driver of whatever profiles are going to be proposed as extensions. So, Eamon, Karima, do you know anything more on the questions
yes,
for Evert?
I can say that in February 2019, the European Commission published a recommendation on some format is for e-prescription and patient summary. So the guidelines that we know that are used in eHealth DSI, digital infrastructure. And also they extend, as Alexander said, with other domain in radiology, laboratory, and the patient summary for rare disease. So as you know, for radiology is DICOM standard that is used. And for laboratory report and imaging diagnostic report, they propose to use CDA, level 1 and level 3. Same for patient summary. And also to start to work for the future using FHIR standard. That is for the next step. So is what Alexander said, then there is this project called eHealth, working on the extension. So from the 4 domains, radiology, laboratory, discharge letter, and patient summary for rare disease. And the specification is ongoing using CDA release 2 and starting to investigate also FHIR standard. I hope I answer your question.
Yes. Well, Switzerland is a nice example, and well, it's I know how you're working, so I think you also use the IHE Swiss example to explain to Europe. Europe is kind of Switzerland with all those states. IHE Swiss is a nice example of how you can use IHE to get a well working environment. Okay, thanks.
Yeah, and just to add, just to support what Karima has said, as Karima has mentioned, those standards have been leveraged, the DICOM, EDA level 1 and 3, for those additional use cases of the eHealth project. So huge work is underway, and Karima is heavily involved in that to develop the specifications, not just from the recommendation that was issued, as Karima had said, but actually to develop the implementation specifications to make that a reality. And we just had the EU full day eHealth member state expert group, the EMSEG communities meeting on Tuesday of this week. And we had presentations from eHealth, and we've also had collaboration with the Unicom project. So there is a great push and initiative from the European perspective to keep the work and the good standards of IHE profiles firmly embedded throughout the member states in the exchange of information. So just to add to what Karima has said. Thank you, Karima.
I think Thierry wanted to say a few things.
Yeah, T here, IHE Netherlands too. In our country, legislation is being prepared by the ministry, and that for specific use cases. And funny was when in 2015, when the 27 profiles were recommended by EU Commission, the Ministry of Health asked me, can you give a presentation what this will mean for the Ministry of Health? I'm a member of the expert group standardization of the ministry. And I told them, nothing if you don't incorporate them in your strategy or policies. If you don't pick it up, yeah, nothing happens. But now in the preparation of the legislation, I see that ministry is also doing now a maturity scan for use cases, for looking for all the layers of the multi-level of interoperability. And at the end, they should test. Does the use case work? And we are also now involved in the expert group to talk about what should be tested, what should be certified. So I think in our country, that is a critical phase, how to get the right things in what to test. That's some extra input.
Thank you, Thierry, for your comments. I think they are of great value, and I hope that things will evolve fast in the Netherlands, and hope to be there to support IHE the Netherlands, especially with our new brand, which is IHE Catalyst. So I see that we have Didi Davis from as a panelist here. I don't know, Didi, if you want to share some experience related. I don't know, I know you are not doing exactly projectathons in the US, but maybe it would be nice to share your views on how we can use this or how the projectathon idea could also be operational on the other side of the Atlantic.
Oh, thank you for the opportunity, Alexander. Yes, I will say we do something similar to a projectathon. It's a bit different. In the United States, I work for the Sequoia project, and we are the recognized coordinating entity that are creating the technical frameworks for the standards to be used. And we have we're very grateful that we have a large network with more than 300 gateways that are using IHE standards for the infrastructure to exchange data today with our federal government agencies. So that was our first entry into kind of a projectathon. We do host and license the IHE conformity assessment tooling, virtual machines, and host them to run 4 different testing programs. So we do have like a projectathon effort to a certain extent in partnership with RSNA, the Radiological Society of North America, to do image exchange testing. And that has grown to have a full policy framework around it with the requirements and so forth. So we test for those, and we're very grateful with the RSNA support for that. But I do say that the projectathon efforts that all of your countries that you presented on today are very inspiring to see that the standards continue to be leveraged. I know that our largest network of networks, we have 29 networks today in the States, exchanging data with the 2 primary profiles, which are more federated in nature, the IHE Cross-Community Patient Discovery, XCPD, and the Cross-Community Access, XCA. And they're exchanging, just to give you some numbers, 190 million documents per month. And those are statistics supported by the implementers or vendors and the networks themselves. So I know it's fully scalable, and we are making efforts to use the IHE Fire infrastructure profiles to add on to supplement the actual exchange with the SOAP Web Services standards. So we continue to do what we call Connectathon testing events with the new pilots and early adopters. So we hope to continue learning from all the other implementers across the globe as well. Any questions on any of that? I know we're up on time.
It was nice for you to share your views here, and hope to do similar events on the North American Connectathons to continue this discussion. So since we have reached the top of the hour, thank you very much all of you for participating, especially our distinguished speakers and guests from different parts of Europe and the globe. And I hope that we can continue this information sharing experiences in the past, and hopefully we can do this in a face-to-face manner very, very soon. I think we all miss that. So from my end, thank you very much for being here, and I hope to see you all in one of our future sessions and meet you in person very soon. It's something that I've really missed. So thank you very much.